come. Anybody else got one last one? We'll go leave the kids.
I do have a cure.
You got a cure?
Medicare.
Yes, sir.
You say everybody's got to have skin in the game.
Yes, sir.
Congress, senators, House of Representatives, y'all participate in Social Security just like we do. You participate in Medicare and Medicaid. You guys will get it straight probably in about 15 minutes. I really believe it. I don't understand why you're exempt from everything that we have to participate in.
No, we.
Your salary is what, $175,000 a year when you retire?
No, you don't get that when you retire.
What do you get?
I think it depends on how long you've been in there, and I don't intend to be a 20-year guy. I don't know what the actual percentage of retirement is. I do know this.
I'll trade you.
I do know this. No, fair question. I do know this, but I participate as a federal employee in you get Medicare. We're in the Medicare. I pay my FICA tax. I pay into Social Security. The thing that people sometimes say is, well, I want the health care plan that Congress has got. What Congress has got is there's not some special congressional health care plan. What I get as a federal employee, same thing that Lou gets and others, is you get a choice of 3 or 4 private plans. What I get right now is I have the Blue Cross Blue Shield of Greater Washington and Northern Virginia. It's a plain old private plan, same kind of plan that other people get. There is this misnomer sometimes. One of the things you got to understand is the stuff you always hear on TV. I know this is going to be a shock, but it's not always true. One of the things that I would encourage everybody here is, too many people either just watch Fox News or just watch MSNBC. Neither one of those channels tell the truth. You ought to make sure you watch it, both. Watch the other side.
Watch CNN.
Well, CNN.
That's a compromise.
At least is a little bit more kind of in truthful. But on Medicare and Social Security, we do participate.
I'm glad to hear that.
That is, because and the other thing too is people always said during the whole healthcare mess, we want a plan like Congress. Congress has got a slightly richer healthcare plan, but you do have higher copays. What we ought to try to do, one of the things that I think we ought to try to do is you've got to move, and where's our friends from Augusta Health? Where the real problem, let me just go ahead and now I'm going to get myself in trouble on this, but I just have to tell you, if you really want to know why we have a deficit, you really want to know why we have a debt, it's not really the Democrats' fault. It's not really the Republicans' fault. Whose fault it is? It's the doctors and the hospitals. Now, hold on. Now, let me tell you why. And thank goodness, it's not because they're over. It's because, thank goodness, they have allowed us to live longer than we used to live. When 65 was set as the retirement age, you knew who said it? Anybody know? Bismarck. Great answer. Bismarck said it when he was head of Germany in the 1870s, and he set 65 as the retirement age because life expectancy was mid-50s. So it wasn't a bad deal that says the government's going to give you a check if you outlive life expectancy. Even when Roosevelt set 65 as the retirement age, in 1934, life expectancy was 62. Thank goodness now, their fault. We're all living to 80 plus, and I'm hoping to live to 90.
If everybody would go out and exercise yes, if you take care of yourself.
That's right.
What's really interesting is the majority of the people have 1, 2, 5 chronic illnesses that they expect every single dollar spent on them, and no responsibility.
So you got to have personal responsibility on it.
Personal responsibility.
5% of the population accounts for about 50% of the health care.
Exactly.
So what we've got to do, again, I'll stop, I promise. Anytime the politician says he'll stop when he's talking, he's not telling you the whole truth. But, we got to make sure there is Medicare and Social Security for the young people I'm going to live. But that means they have to be changed a little bit. Not because anything did anything wrong, but just because, thank goodness we're living longer. When I was a kid, there were 16 workers all paying in for every one person on Social Security. Today there are 3. That's good that we're all living on. But it just does mean that all these programs are going to have to be changed a little bit. But we don't have to do it overnight. The reason why we don't want to be the Greeks and the Europeans is if we start now and phase these changes in over 20 years, it's not going to affect people's lives. And the value that we would get from anybody, how many people here are business guys, business people? You know, if you actually knew what your tax code and tax rate was going to look like for the next 15 years, you may not like everything, but at least you can have predictability. And, you know, telling them, the rest of the world, that we're going to get our financial act together ought to be the first requirement of any elected government. And if we don't do it, fire our guts. Excuse my language.